Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Two big issues to appraise the NAAOP members and friends of in November. Number one, the national midterm elections and the impact they may have on healthcare policy and, of course, orthotic and prosthetic care. And number two, the Limb Loss Preservation Registry. First, the election and the results and the implications. Well, the red wave, so-called red wave that many thought would take over during the midterm elections didn't quite materialize, but that didn't stop the Republicans from overturning control of the House. The House will be in Republican hands. It is forecasted and has pretty much been confirmed, although that margin will be very slim, between 1 and 4 votes. That's going to make it awfully difficult to pass legislation from the Republican side, considering the strength of the Freedom Caucus. In fact, the Republican conference just this week had votes on nominations for the Speaker of the House and for the Majority Leader of their party, Kevin McCarthy and Steve Scalise, respectively. Kevin McCarthy received about 180 votes, and he's going to need 218 votes in January from the entire House in order to become the Speaker. There's a real question as to whether he can get that many votes, and the question will become, if he cannot, who will be able to get 218 votes to become the Speaker of the House. On the Democratic side, we just learned today that there'll be a wholesale shift and turnover in leadership. Some would argue it's about time. The fact is that the entire leadership team has been there for quite some time. Nancy Pelosi, Steny Hoyer will be stepping aside from leadership. They'll remain in the House, but they will open up new positions for leaders on the Democratic side in the House for new talent. On the Senate side, the Senate will remain in Democratic hands, Democratic control, and it's assumed that Chuck Schumer will remain and be elected once again as Majority Leader for the 118th Congress or Senate. That begins in early January. It's also been it's been decided that Mitch McConnell will remain as the Minority Leader when the vote takes place in early January, even though he was challenged this year by Rick Scott from Florida. So the Congress is going to be extraordinarily evenly divided again, much like it was in the last 2 years. So for the remainder of the Biden administration, there will be divided government. You're going to see a lot more investigations. You're going to see a lot more activity from the House that you didn't see in the past. What does that mean for the lame duck session? I think it means that the Democrats will try to get the biggest bill they can possibly get through. And there is a massive vehicle that will otherwise be traveling through the Congress, and that is the omnibus spending bill to fund the federal government past December 16th, which is the current date when the federal agencies no longer are funded and the government will shut down unless Congress acts. We don't expect that the federal government will shut down. We do think that there will be a massive bill being passed, and that will offer an opportunity for other groups to try to tack on legislation, other lawmakers to try to get through priorities that they've been working on for some time. So we expect to see some telehealth provisions, some fixes to the physician fee schedule, which is slated for a 4.5% cut, rather than over an 8% increase that O&P and the fee schedule will receive this year. This coming year. And also ultimately, it does offer opportunities to try to get the Orthotic and Prosthetic Patient-Centered Care Act, or key parts of it, attached to that bill. We're working hard to make sure that we get something from that process, although it's an extraordinarily dicey issue at the end of a lame duck session. Let me switch to the Limb Loss Preservation Registry for a moment. Over the past 4 to 5 weeks, there's been a tremendous amount of activity on the registry. The external collaborative panel, which essentially serves as an advisory board to the registry on which I serve, met in Rochester, Minnesota. There is a real sense of urgency and purpose and concerted effort to try to launch the registry into a freestanding entity. Currently, it's a grant from the federal government sponsored by NIH and the Department of Defense, and it's housed at the Mayo Clinic. But we're actively searching for hospitals, hospital systems, and especially O&P clinics to contribute data to become a member or join the registry and begin translating and transmitting data to the registry to try to grow and build the most significant and robust set of data we can use for quality improvement, for selection of patient care, both from a practitioner and a patient perspective, and for improvement of quality outcomes. So we strongly encourage you to join the registry. There's a $1.6 million left of funding over a 14-month period, and then the registry is expected to launch into an independent organization. Please contact Kathy Bernhardt at mayo.edu. The address is below, and we hope that you will do so as soon as possible. Thanks so very much, and happy Thanksgiving.